Edwards with the YogAlign YouTube channel, and I'm a YogAlign innovator. I invented it, and also a posture educator and a licensed body worker for over 2 decades. Knee pain is something that's afflicting millions of Americans, and many people are having to have knee replacement surgeries. And I've even read things that the human knee is not designed well, and that's why we're having all these problems. Now, what I found in my work is that the knee is it's just a hinge, and it wants to just be able to hinge. But when we are collapsed, when we have poor posture habits, when we have poor breathing habits, the whole weight of the trunk is just sitting on that knee. And that's one of the reasons why you can't fix knee pain just by trying to work with the knee. You have to think of the global posture patterning of the whole human body. So in YogAlign, we use a breathing technique that lifts and expands and kind of inflates the trunk so that your hips and knees are literally floating underneath this lifted structure. Now, most of us don't have a lot of lift to the body because we've been put in chairs. And chairs override our natural expanded self, because as soon as we get in that right angle, we're shutting down, we're using the periphery. So what we do in YogAlign is we're always seeking to create that inner expansion and that lift that really takes no effort. And then the knees can simply float underneath the body. So I'm going to use a breathing technique that we use a lot in YogAlign that strengthens your abs, but in a way that happens from the inside out. Because you don't want to strengthen your abs to shorten. That's one of the things that causes knee pain, actually. When the abs are really strong and tight, pulls the head forward, and then you go out to run and your knees aren't floating underneath you. They're compressed. So oftentimes when I work with athletes, I simply show them how to rewire the tension in their trunk. They're still strong, but they're just not strong in a short way. And that's what stuck in the exhale, what I call it. Like if you exhale hard, look, you get stuck in that position, your knees are going to hurt. Lots of things are going to hurt. So we start with the breath. You make your lips like you're about ready to whistle. It can't be a straight line. So you go like this, you breathe in, create lift. You let the breath out slowly with a sound like you're making an S, and you try to feel your body get taller, like this. You get taller. Now, simply doing a few of these, it's amazing. If you have knee pain right now, you can simply use this breathing technique. I'm going to use a scoop at the same time because you can't have your shoulders higher than your breastbone. Nothing's going to work right. I'm not going to be able to breathe. It's actually going to make my knees hurt. So we're going to scoop to get the ribs balanced, and I'm going to breathe in, create this lift, then I'm going to let the exhale out slowly, maintaining the lift, and suddenly your knees can float again. And even things like torn meniscus and bursa and ligaments that are supposedly gone or whatever, the human body can heal, but you have to get rid of the tension and the compression that caused the injury to begin with. So in YogAlign, we're not just looking for Band-Aids, we're looking for solutions. And that comes through creating the lifted, expanded being, bringing that back in, because the human body kind of shrinks and collapses. So we're here to show you how all you have to do is use a movement of breath. You breathe in with the strong sip. The body's lifted, your knees are saying, hallelujah. Subscribe to our channel because we've got a bunch of information for you that really helps. Self-help tools. We don't have a healthcare crisis in America. We have a self-care crisis. So if you want the tools to let your body heal itself, we've got them. Aloha from Kauai.